Hi guys. So I'm going to be sharing my presentation on hepatoviruses today. And my name is Leanne McNall, and this is our week on pediatric infectious disease. So for mode of exposure, there are five different viruses. So it's which cause hepatitis A, hepatitis B, hepatitis C, hepatitis D, and then E. So hepatitis A is spread by the fecal oral route. So in patients, this usually happens from ingesting food or water that was contaminated by feces from an infected person. It's also highly associated with people who have anal and oral sex, poor sanitation, and or unsafe food and water sources. For hepatitis B, this usually occurs in high endemic areas where the hepatitis B, the virus HBV is spread from mother to child during birth. Other ways that someone else could get Hep B is through a needle stick injury, tattooing, piercing, or exposure to bloodborne pathogen or other fluids such as saliva, vaginal fluid, semen, or menstrual blood. Hepatitis C is a bloodborne virus. It can be transmitted by inadequate or reuse of medical equipment if there is a transfusion of unscreened blood that's been infected, or sharing of needles with an infected person. HDV is transmitted by broken skin, so either by tattooing or an injection from a bloodborne source. It can be given from mother to child, but that's very rare. And then chronic HBV patients are more likely to contract HBV, and you actually can't get HDV unless you have HBV. Hepatitis E is caused by HEV, which is mostly transmitted from contaminated drinking water sources, and it's shed through the feces, which then enters our human body, and then we get it through the intestines. It's also likely to spread through the ingestion of inadequately cooked meats like raw meat originating from an animal that was infected before we killed it for consumption. Prevention of exposure. So hepatitis A, you want to have excellent personal hygiene, hand washing, and then consumption of safe drinking water. We can give the HAV vaccine administration for infants who are 1 year and older. For Hep B, the initial infection can be prevented by the Hep B vaccine, which is given to newborns right after they're born or at their first newborn visit. And if the mother is infected with Hep B, we want to give the HIV vaccine, which is the prophylaxis. Hepatitis C, there's no current vaccine against HCV. The only way to prevent it is to encourage safe sex practices and behaviors with teenagers and adolescents. You want to produce more efficient screening for bloodborne pathogens if you're going to give blood administration in a hospital, and then also safe handling of needles for medical workers. For hepatitis D, there is also no current vaccination, but the HBV vaccine is preventative of HDV because of how you have to get, if you have HBV, that's the only way you can get HDV. And then hepatitis E, you want to have that excellent hand hygiene and access to safe drinking water. It's very crucial. It's a self-limiting virus, therefore we don't need a vaccine for it. Okay. So treatment plan, it's very different depending on what type of, which one of the virus that you've contracted. So for Hep A, it's supportive. We want to educate caregivers that they need to have really good hand hygiene after changing the diaper. And then also the PDNP should administer the immunoglobulin or the HAV vaccine within 2 weeks of the exposure. For hepatitis B, if there's a suspected reactivation of chronic Hep B, we want to refer to a pediatric hepatitis B specialist. And then these are the drugs that the FDA has approved. It depends on age. So for 12 months, you're going to give interferon alpha. For 3 years and older, you're going to give lemivudine. For 12 years and older, you're going to give adenofor and tenofovir. And then 16 years and older, you can give entecavir. For hepatitis C, we're also acute HCV is supportive. And then when you go into chronic patients, if children are ages 3 years old to 17, you want to give non-pegylated interferon alpha -2B and ribavirin. And then the HAV and the HB vaccines should be also administered to this population. It's very important. Hepatitis B, where there's no course of treatment. However, like we talked about before, a child cannot get HDV unless they have HPV. And then for hepatitis E, it is a self-limiting virus. Therefore, we're going to look for just supportive care for this population. Okay, and so I wanted to look more into hepatitis C because I wanted to know what happens to the kiddos that don't that are younger than 3 and that do have the HCV virus. So according to UpToDate, children who have contracted HCV under the age of 3 years old, we should actually defer treatment due to the fact that the HCV may spontaneously resolve, which I had no idea. So that was really interesting to me. And then there are 2 other drugs that, other than the ones that I had posted from our text, that UpToDate says that you can use for children 3 years and older. So that is sofosbuvir and valproatovir together, and you could give that. It should be given for 12 weeks, and then the glicabravir and pibrentemvir adjunct should be given for 8 weeks, and this should only be given for patients who have never received any sort of treatment for hepatitis C before. And then these are my references. All right. So I hope you enjoyed my presentation, and I can't wait to learn from the rest of yours. Thanks.